Good morning. Today we're going to talk about a pilot study of focused ultrasound telemetry for essential tremor. First, we gotta know what is it. Essential tremor, ET, also referred to as a benign tremor or familiar tremor or the shaking hand syndrome, is the most common movement disorder. It typically involves a tremor in the arms, hands, or fingers, or sometimes involving the head or other body parts during voluntary movement, such as eating, writing. It is distinct from Parkinson's disease, and often misdiagnosed as such, although some individuals have both conditions. Signs and symptoms: the inability to stop the tongue or hands from shaking, the ability to sing only vibrato, difficulty to do small, precise tasks such as threading a needle. Even simple tasks like cutting a straight line or using a ruler can range from difficult to impossible. Depending on the severity of the condition, interfere the person's ability to perform tasks of daily living, including feeding, dressing, and activity of the personal agent. This is an example of what it is to have essential tremor.
Okay, I have essential tremors in my hands and arms, but also in my legs, mostly in my hands and arms. And basically, as you can see, when I'm at rest, they're calm, there's no shaking. But whenever I do any type of activity, including just lifting my arms off the table or trying to shake, just to give you kind of a sample of that. So they start to shake immediately, but you also notice it a lot when I just move my hands up and down like this. You can see the tremor going all the way up the arm. I have particular difficulty when I'm trying to do fine motor functions like writing, because my hand shakes. I'll demonstrate by drawing a swirl. And I can draw a swirl, but I can't do it without shaking. And so it looks like this when it's finished. Similar trouble when I'm trying to write my name. I can write it if I do it in print, but if I try to keep the pen on the paper for cursive, it's more difficult because my hand's shaking, and it looks a lot more like a child wrote it. Anyhow, it is a primarily genetic condition, so if anybody else in my family has similar difficulties with shaking when they're moving, then please, I would like to talk to you, because I just want to know if it is actually hereditary in my case. Let me turn it off here.
What is have to have essential tremor? Okay, when does it occur? Essential tremor generally presents as a rhythmic tremor from 4 to 12 Hz. It occurs only when the affected muscle is exerting effort. Any sort of physical or mental stress will tend to make the tremor worse. Causes. As I said, the underlying etiology of essential tremor is not clear, but many cases seems to be familiar. Approximately one-half of the cases are due to a genetic mutation, and the pattern of the mutation is most consistent with autosomal dominant transmission. No genes have been identified yet, but genetic linkage has been established with several chromosomal regions. A number of environmental factors, including toxins, are also under active investigation, as they may play a role in the disease etiology. Now, this is another person that has essential tremor that is going to explain how it is like to have it.
Hello, my name is Daniel, and I'm 22. And I just wanted to share my story with So it begins when I was 11. I was born healthy. Then when I turned 11, I started to get slight tremors in my right hand. Just one hand, slight tremors. And then it progressed more and more. Like it went to my head, my voice, you can't tell. And like my feet, my body, so I just shake. It's kind of awesome. No, it's not. And so it progressed, and the doctors diagnosed me with something called leukodystrophy, except I think they diagnosed me incorrectly. I think I have the disease called essential tremors, because I see all of the same symptoms. And like, it's very difficult for me to shave. I need someone to shave for me because I don't want to cut this big, beautiful face of mine. So, and like eating soup, oh my goodness. I eat soup and kind of feed everyone around me because like just it falls out of my spoon and like hits everyone. So, and let's see, what else is difficult? Oh yes, I can't drive a car. It sucks so bad because I want to go places and I can't. Holding a glass of water, you could imagine, would be a disaster. Let's see. Oh yes, when I was born, up until the age of 10, I was writing. I wrote with my right hand and did everything like writing people do. And then I got sick, my right hand started to progress very rapidly. So I needed to teach myself to do everything with my left side of the body, so now I'm a lefty. And yes, so that's a little bit about this disease. You shake, so if you do see someone shaking, don't automatically judge them. You're like, oh, they're scared or something. Maybe, but maybe not. So, I guess let me show you some things I cannot do. I cannot write on the paper whatsoever. And it sucks very much because I very much like poetry and stuff like that. So here, let me show you an example. I'm going to just make circles, and these circles, as you can tell, I shake very much. Now, my right hand, I didn't do anything with it yet because it doesn't listen to me. So, here it goes. Okay. Sorry, but that's what happens. So, and one more thing I would just like to say is about God. I am a Christian. I believe in Jesus Christ, and He has helped me so much through this whole experience of 11 years that I've been sick. Like, sometimes I would be so depressed, I'm into the point of suicide, and God would just come in and encourage me. And that's why I smile so much and why I'm happy. Is because God encourages me to keep going and to keep progressing on and not to give up. So, all my joy is because of God. Yeah, and there was something else I was going to say and I forgot. So, yeah, but that's it. That's kind of my story.
Well, Now, let's talk about the treatment. The procedure was performed in an MRI guide focused ultrasound system consisting of a 3 Tesla MRI GA and the exaplate neuro inside which include the hemispheric for 650 kHz and 1024 elements phases array transducer. A reference scan was performed to position the transducer to the target. A series of anatomical MRI scans were focused for the operative craniotomy scan of the skull correction algorithms. Traditional stereotypic planning was performed for the ventral intermediate thalamus as 3/4 of the leg of the anterior posterior commissural line, 14 to 15 millimeters lateral of midline, and 11 millimeters from the third ventricle wall in cases of ventriculomegaly. Now the results. The creation of lesions in the ventral intermediate nucleus of the thalamus and electrical stimulation of the same region, which is part of the large tremor circuit that integrates kinetic and proprioceptive sensory information from the cerebellum and spinal cord with the cerebral cortex, are effective surgical intervention for tremor. This is an explanation about all these tests.
I'm a neurosurgery resident. I work with Dr. Andres Lozano at the University of Toronto, and we have been using focused ultrasound now for over approximately 2 years, specifically for the management of essential tremor. And we're conducting one of the world's first trials of using focused ultrasound for tremor in patients who have reached the limits of medical treatment for their condition. Today at the World Society for Stereotactic and Functional Neurosurgery, we presented our results in the first 5 patients in our study that have reached 3 months of clinical follow-up. The 5 patients have an average age of about 70 years old. They're all male. And they've all been sick for at least 17 or 18 years, and they've all been deemed treatment refractory. So a movement of neurologists has deemed them eligible for some sort of surgical intervention. So these patients underwent baseline investigations, including a tremor assessment, and then we followed them at certain time points, 1 and 3 months after their treatment. And what we found was when you use a rating scale that's very commonly used in essential tremor to measure the severity of the tremor, you see significant reductions in the total tremor score with time at 1 and 3 months compared to baseline. If you focus only on the tremor score affecting the dominant arm, or the arm that we treated, you as well see a dramatic decrease in that tremor score at 1 and 3 months. Importantly, that effect is maintained several months after the procedure. But in addition to that, in addition to just seeing an improvement in the score, what you're seeing also is a substantial improvement in patients' quality of life and in their ability to conduct those very activities that before the procedure they weren't able to do. And that's reflected, again, in significant improvements, both subjective, both in what patients perceive that they can do now that they weren't able to do before, and also objective measures when we get them to do certain tasks like writing or spirals, etc. So, all of these measures, there seems to be a significant improvement in these patients that's maintained several months after the procedure. Technically, it's known as benign essential tremor, but it's a misnomer. There's nothing really benign about essential tremor in its most severe form. So it's extremely disabling to patients that suffer with it. So patients are unable to eat, drink, or unable to really conduct any of the activities that we take for granted on a day-to-day basis. So one particular patient comes to mind. He is an engineer. So he's in his mid-60s. He's been suffering with the disease for well over 15 years. He had to retire early because of his condition. And he's an otherwise very healthy, robust, energetic man. But you can tell that because of his tremor, he's been reduced to truly somebody who is very disabled. So he is unable to even feed himself. He is unable to drink anything on his own. He cannot write, so he's a very talented draftsman. it used to be, and now he cannot put a pen to paper at all. So this is somebody who would otherwise be traveling the world. This is according to his own words, and seeing the sights and really living a very vicarious life. However, because of his disease, he's really unable to do anything on his own. So as soon as he left to the scanner, his tremor on his right hand was gone. So he no longer had the tremor. He was able to drink from a cup for the first time in over a decade, and really, truly was a remarkable success story. And we saw him 3 months after his procedure, and all of the benefit that he had initially was still there, and he was beginning to resume those very activities. So I think that the advantages are clear and they are quite obvious, specifically with regards to other kinds of ways of making a lesion in the brain. So I think that the best comparison is really to show the advantages of magnetic resonance, of MR-guided focused ultrasound, is really comparing it to something like gamma knife radiosurgery, which is the alternative, non-invasive lesional approach to essential tremor. So it doesn't involve focused ultrasound doesn't involve an incision. The effects are immediate. We're able to see the lesion developing with high-resolution MR imaging. We're able to monitor the temperature of the lesion as it happens. We're able to speak and communicate with the patient during treatments. We're able to see the effect on the tremor as we treat it. So really, for all of these reasons, it's an extremely powerful technique that we think will only continue to improve.
Conclusion: unilateral thalamotomy improved tremor in the contralateral dominant hand and overall tremor, as measured on a validated tremor rating scale. Patient reported improvement in tremor-related quality of life after the procedure. Thanks.